everyone, and welcome to today's episode of Health Mantra with Manipal Hospitals. I'm your host Heather, and today we're going to be diving into a topic that is very often hushed. It doesn't get the attention it deserves, and when it does, it often features as the punchline of a joke or as a flippant dismissive remark. I mean, how many times have you heard male colleagues, friends, and even family make dismissive remarks saying she's menopausal or he's probably menopausal? Today we're here to clear the air because, like it or not, for many women, menopause is no laughing matter. Yes, it's a natural phase of life, but it brings with it its own physical, mental, and emotional challenges. Today we're here to provide real insights into what menopause truly means. And to do that, we have Dr. Kinjal Kothari, a consultant obstetrician and gynecologist from Manipal Hospitals, Goa. Hello, Dr. Kinjal, and thank you so much for joining us here today.
Thank you so much, Heather and Prudent Media, for inviting me over for this discussion.
Now, Dr. Kinjal brings a wealth of knowledge and expertise, and she'll guide us through everything from common symptoms to treatment options like hormone replacement therapy, and even how simple lifestyle changes can have a significant impact on quality of life. Dr. Kinjal, welcome. Let's start with a very simple question, which is, what is menopause and when does it typically occur?
Okay, so Heather, menopause is not a disease. It is a very naturally occurring process. It occurs most commonly in females aged 45 to 55 years. So menopause typically marks the end of the reproductive or fertile period of the females and typically cessation of their menstrual cycles.
Doctor, we are in October, and October 18th is World Menopause Day, which is a day to spread awareness. Now, everyone knows about the most common symptoms of menopause. You know, you have hot flashes, irregular periods, insomnia. Are there any more symptoms that our viewers should know about?
Yes, there are a lot more symptoms in addition to this. Basically, menopause is a decline in the female hormones, mainly estrogen and progesterone. These estrogen receptors are present in most of the body organs. So now that this hormone is declining, all the body organs which have the estrogen receptor would exhibit some or the other symptoms related to its deficiency. So starting with the brain, you can have symptoms like mood swings, you can have hot flushes, you may start sweating. The female who is experiencing menopause may start sweating in an AC room. She might have her night sleep which is disturbed, she might have insomnia, irritability, chidchidapan. Then there might be urinary urgencies as well. She may have the urge to pass urine frequently, she may not be able to control her urine before she reaches the washroom, or she may pass urine with coughing or sneezing as well. Then there are symptoms like vaginal dryness, then there's joint pain, backache. These are because of osteoporosis per se. One more symptom is vaginal dryness and loss of libido, which affects the sexual health in many females. The most common symptom which females experience is weight gain. Now, weight gain per se is not because of the unhealthy diet they might be taking or because of the excessive eating or lack of exercise. It is mainly due to water retention in these menopausal females.
Doctor, you spoke about symptoms of menopause. Now, that is how I would tell that I'm going through menopause. But is there a way to medically diagnose menopause?
Yes, there is. So basically, menopause is defined as cessation of your periods. That is, you don't get periods for a continuous of 12 months. So supposedly, if a female has got her last period in December 23 and now again this time in this month she starts having her periods again or she spots a little bit, then that female is not considered to be in menopause. It has to be continuous period of 12 months or a year to consider as a menopausal state. Also, there are some hormonal tests available. The most commonly being a hormonal test called FSH, that is the follicular stimulating hormone, by which we can know whether you are progressing towards menopausal state or not.
Doctor, now all of these symptoms, of course, we will be talking a bit later about how we can alleviate these symptoms, how we can make simple lifestyle changes and other treatment options. But before we get to that, now when you talk about menopause, there is another phrase that, another word that is even lesser heard, which is perimenopause, and that is a stage which brings its own challenges. Can you tell us something about perimenopause?
Perimenopause is basically a transitional period which leads ultimately to menopause. It may last up to several years. For some females, it may last up to 2 to 8 years. So perimenopause is mainly characterized by irregular periods. By irregular periods, I mean that the cycles might be becoming shorter. They might get periods every 20-25 days, or they may not get periods for consequently 3 to 4 months, or there might be some form of spotting before periods or after that. And also, in addition to this, there are a lot of other hormonal disturbances involved with perimenopause.
We spoke about menopause, perimenopause. What about early menopause? Is that something that we are seeing nowadays?
Yes, early menopause, which is medically termed as premature ovarian failure, is when you get menopause very early, before the age of 40. Now, it can occur at any age. There is no such cutoff criteria to define at what age you will get an early menopause. It is in many females now it is seen because of the lifestyle disturbances and the increasing stress, work stress these days.
Now, is there an age bracket for perimenopause?
As such, as I said earlier, perimenopause can last up to 2 to 8 years. So we cannot define any age exactly at which a particular female will be going through the perimenopause. At what age you get menopause also depends on the genetic part. So if your mother had an early menopause, there are chances that the female might also be having an early menopause.
But you said menopause is between the ages of 45 and 55. So how early, would you expect perimenopause to hit?
After 40, maybe after 38 to 40 years, if you are experiencing all of these symptoms that we enlisted, the menopausal symptoms, in a very less severe form, then you can be considered as perimenopausal.
Okay, so 18th October, as we all know, is World Menopause Day, and menopause is usually something that is, swept under the carpet. Do you think there is a need for celebrating a day like this?
Yes, definitely. 18th October is celebrated as the World Menopause Day by the International Menopause Society and WHO. The need for such a celebration is mainly to raise awareness and enlighten the female about this problem, and also mainly to help them discover all the treatment options that are available and make their lifestyle better. Now, one more thing I would like to add to this is WHO dedicates a theme every year for the International Menopause Day. Last year the theme was cardiovascular diseases. This year the theme is going to be HRT, that is hormonal replacement therapy, which we will be talking about subsequently.
Before we get to hormonal replacement therapy, can you talk about diet and lifestyle changes? You said, there are certain things that can be done to alleviate symptoms, so that we can have a smoother transition. Can you tell us a bit about this?
Diet and lifestyle changes play a very major role in influencing menopause. So, in the lifestyle changes, everyone should focus on exercising. By exercising, I mean a low impact exercise like cycling or yoga or swimming for at least 30 to 45 minutes a day and 5 days a week. And in addition to this, regulating your sleep cycle also plays a very major role. Having a proper sleep cycle, staying in a stress-free environment, And also one more major thing is limiting your caffeine, alcohol and smoking intake also plays a very major role. Now as far as diet is concerned, all the females should include more of green leafy vegetables and fresh fruits in the diet. You can have egg, chicken, fish, but try not to have it in a very try to have it in a grilled way. Don't over fry it, don't fry it or have very spicy or oily food. Second thing is calcium and vitamin D are the two most common vitamins that are needed for menopausal women. That can be supplemented either by diet or supplements, vitamin supplements in form of tablets are also available. Calcium is available in many food items, mainly milk, paneer. Also, menopausal females should take a proper intake of soya bean, ragi and all such things which are a natural form of plant estrogen to combat the menopausal symptoms that they are facing.
Because of the drop in estrogen.
Because of the drop in estrogen, yes.
Another concern that many women have, once they are in the menopausal phase, is long-term health risks like osteoporosis. You mentioned something about heart disease. Is there anything that women can do to safeguard their health?
The lack of estrogen definitely is the main cause of this heart diseases. Estrogen is what we call a cardioprotective hormone. Now that estrogen is declining, you are more prone to getting heart diseases. Also, that is why the last year's theme of the World Menopause Day celebration was focused towards educating females about the cardiovascular diseases. To avoid all such long-term consequences having an effect on your health, all the women should focus on healthy lifestyle, eating proper food. Basically, lifestyle and diet are the two key ingredients to having a very healthier menopause and a smooth lifestyle in this menopausal period.
So last year's theme was cardiovascular diseases. This year's is hormone replacement therapy, or HRT as it is called. Can you tell our viewers what exactly HRT is in relation to menopause?
HRT is, as it is called, a hormonal replacement therapy, is giving hormones artificially because after menopause they are not being produced in your body to decrease the risks and the long-term effects of menopause. Now HRT is given in form of, there are many combination forms of HRT. It depends upon the individual preference in which form they want to take the tablet. For example, one common form is a tablet, then there are patches available, gels available, vaginal creams available. Of all these are of course hormonal. So individual preference here and the individual needs play a very important role in the form of HRT being given to each and every patient.
Doctor, when you say hormonal replacement therapy, there is estrogen and there is progesterone involved as well. Can you tell our viewers a bit about, how each of these hormones or both of these hormones would help?
Estrogen based hormonal therapy is mainly given to patients who have undergone hysterectomy or patients who do not have a uterus. Estrogen and progesterone combined hormonal therapy are basically used for patients who have an intact uterus. Now there are also, as I said, other formulations of hormonal treatment, hormonal replacement therapy available like gels or patches. That can also include either one component only. There are estrogen gels available which we prescribe the females for vaginal dryness. And there are patches also available if some females are not comfortable in taking the oral form of tablet for hormonal therapy.
How do you determine if somebody would be a suitable candidate for HRT?
A suitable candidate for HRT would be a female who is having all these perimenopausal and menopausal symptoms as we discussed earlier, and provided there are a few certain things which should be kept in mind, like if you have a family history of breast cancer or you have suffered from breast cancer earlier, or there's any liver disease, or you're suffering from hypertension, stroke or any gallbladder disease, then having all of these things do not make you a suitable candidate for HRT. So it has to be tailored as per the individual family history and patient profile also.
Doctor, you said about, you spoke about who is a suitable candidate. Can you elaborate a bit more on which women should not look at HRT as a form of therapy for menopause?
So, all the females who have had a history of breast cancer or they have had a history of stroke, are suffering from hypertension, or have any form of vaginal bleeding or any uterine cancer or any hormone based cancer in the body, ideally should not go for hormone therapy, because hormone replacement therapy is again giving artificial hormones to the body.
Interesting. Doctor, now you said that HRT can be started in the perimenopausal phase. Now, if you start your hormone replacement therapy, so basically you're taking in artificial hormones. Now, if you start taking in hormones in the perimenopausal phase, would it delay menopause?
No, it wouldn't delay menopause per se. It will just help you in the symptoms of menopause and the side effects of all these things that you are facing, and make your lifestyle a little better.
When you say side effects, you're talking about symptoms, or is there more?
The consequences of menopause,
for example, osteoporosis,
or joint pains, basically joint pains, backaches, heart diseases.
Okay. Now, every treatment, of course, comes with its benefits and its risks. Can you tell us something about this?
See, all the hormones that you are artificially taking would cause common symptoms like a little nausea, gastritis, bloating. In addition to that, some females can also have headache after taking hormonal replacement therapy. There can be breast tenderness. Also, if you are on hormonal replacement therapy, it is very important to keep a regular follow-up with your gynecologist, just to see any side effects are being developed because of the tablet or not, and then decide whether to continue or to taper the therapy accordingly.
Would the benefits be more than the side effects? I mean, is it worth it? Is HRT worth it?
Yes, it is definitely worth it, but we have to see that the woman is not, the other organs of the body are not compromised because of the hormones that we are supplementing to the female.
So basically what you're saying is you consult your gynecologist, and it's a very monitored therapy.
Yes, definitely. It is a monitored therapy, and even after 40 years, one important thing that I would like to emphasize over here, that every female after 40, whenever she hits perimenopause or menopause, should go to her gynecologists for regular checkups. By regular checkups, I mean to say she should get her mammography done, her ultrasound, that is the sonography done, and even pap smear. These three are very important after the age of 40 years for every female, irrespective of starting HRT or not, for your general health and well-being.
Can you tell the viewers why particularly sonogram, pap smear, mammogram?
Mammogram basically is done for early detection of breast cancer. After 40, or if you have any family history of breast cancer, then please go and get yourself screened regularly. Usually we advise mammogram every 2 yearly. Ultrasound is for the general well-being of all the abdominal organs and to see your uterus, ovaries. And pap smear is for the detection of cervical cancer. Pap smear is ideally advised from a very young age, but after 40, if you are going for health checkups, then please get it done regularly.
Doctor, there are also many misconceptions surrounding menopause, surrounding hormone replacement therapy. Are there any that you would like to debunk for us today?
Yes, the most common misconception is that menopause is a disease. Per se, menopause is not a disease. It is a very naturally occurring phenomenon, and the most important thing that every female needs in her life when she is going through menopause is the support of her partner and her family and friends to help her combat all these symptoms that she would be facing. So social support here plays a very important role. Secondly, many females think that HRTs can cause cancer. No, if HRTs are taken in a very controlled manner, and also if you are going for regular screenings, then it is very much safe to use.
Any advice for women going through surgical menopause due to hysterectomy or other such procedures?
So basically, as you talked about hysterectomy, if you're going for some reason for a hysterectomy and if your ovaries are well conserved, then you might not hit menopause early. Ovaries are the main organs which are producing all these hormones. So when your ovaries are removed in hysterectomy, then you might need HRT at a little earlier stage.
Wise words, Dr. Kinjal. Thank you so much for joining us here today. I'm sure our viewers have learned a lot. That was Dr. Kinjal Kothari, helping us break down the myths, discuss symptoms and treatment options, and helping us understand how we can navigate this phase of life with confidence and care. If anyone has any questions, Dr. Kothari is available Monday through Saturday from 9:30 a.m. to 11 and then from 2:30 p.m. to 5 p.m. at Manipal Hospitals in Donapola, Goa. Thank you, Dr. Kinjal, for sharing your time and your expertise with us.
Thank you.
To all our viewers, that's all we have for today. This is Heather signing off. Until the next one, stay informed, prioritize your health, don't make flippant remarks, and we will see you again right here on Prudent Media.